Autism is a developmental disorder that may affect social interaction, language development, and a child's perception of his or her environment. Some autistic children may have symptoms that are barely noticeable and grow to be successful adults. Others with autism are severely disabled for life. Autism seems to be at least partly genetic, which means you were born with it. But the diagnosis is frequently not made until 2 or 3 years of age, when language delay or failure to meet developmental milestones becomes more apparent. Autism occurs in about 7 out of 10,000 people. Brothers and sisters of autistic kids are more likely to have autism than the general population, but the occurrence rate is still very low, less than 7%. Kids with other genetic disorders are at increased risk of having autism also. Nobody knows for sure what causes autism. Vaccines and vaccine preservatives were once labeled as possible causes, but extensive research has not proven a link. Autism is probably caused by a combination of factors. For example, autism may be caused by exposure to a chemical or virus in a child or a pregnant mother who has a specific gene abnormality. There is no laboratory study or X-ray that can diagnose autism. The first clues are often reported by the parents. For example, if the child does not babble, point with a finger, or make gestures at 12 months of age. If the child is not using single words by 16 months, or two-word phrases by 24 months of age. Or if the child has any sign of losing previously gained language or social skills. A doctor's office may ask the parents to fill out a survey that asks questions about the child's skills and behaviors. Some tricks that a doctor may try are to point to an object and say, "Hey, wow, look at that red truck." Most normal curious kids will look immediately. Or the doctor may ask, "Where is the truck?" And most children old enough to point will do so. Normal children love to pretend. Autistic kids have difficulty understanding or performing pretend play. So, for example, a doctor may hand the child a pretend cookie to see if the child pretends to eat it. Other medical conditions that may be confused with autism should be ruled out, and this includes lead poisoning, hearing loss, mental retardation, or other genetic conditions such as tuberous sclerosis or Fragile X syndrome. Some medical conditions may occur in combination with autism. Delays in diagnosis are common because either the doctor or family may not want to label a child with a lifelong disorder until the symptoms are absolutely clear. Autism is often associated with mental retardation, but many autistic kids have normal or near normal intelligence. Autistic kids may avoid talking to or playing with other children, develop strange repetitive behaviors such as clapping the hands or head banging against a wall, or pay an unusual amount of attention to objects. There is no specific medication for autism, but behavior therapy may be helpful, especially if started when the child is very young. A structured environment with a strict, consistent discipline strategy is important. Individual education plans or dedicated tutoring is very helpful. Medications may be helpful to treat some of the symptoms, especially if the child has a behavior disorder or seizures also. Caregivers of autistic kids are heroes of parenting. So if you happen to know somebody who has an autistic child, please give them a pat on the back or offer to help with babysitting every once in a while. This is Dr. Michael Davis. For more information on this or other kids' health topics, please visit healthykidtips.com.